When I was 3 years old, my 27-year-old fighter pilot father died of polio. And I grew up very aware of just how important health protection was. I spent close to 10 years at CDC as the director of the National Center for Environmental Health. 10 years ago, if you said, how we build America makes children unfit, makes adults overweight and obese, makes elderly people depressed, people would say, wait a minute, where's your data? Where's the evidence? And more we've learned, the more we isolate people, the more we take away children's walking and biking ability away from them, the fewer parks we provide to people, the less healthy people are. And so 100 years ago, the link between bad water and bad air and human disease was pretty obvious. And now I would say over the last 10 years, the link between bad built environments, environments that are hostile to humans being together, humans walking, humans exercising, that link has become quite obvious. And now people are grappling with, how do we fix this? And so one of the good things that's come of this is, for example, the California Medical Association now has policies on not just sugar-sweetened beverages, but on the design of communities. The Academy of Pediatrics has policies on the design of communities. And this was kind of unimaginable 10 years ago. And even the transportation agencies are beginning to realize, oh, we're a health agency. Housing agencies, they're health agencies. Agriculture, it's a health element of our society, and health needs to be involved with each of these, because having doctors sit at the end of the disease pipeline trying to fix up the casualties of how we have built America, the obesity that we've created, the inactivity that we've created, doctors can't fix this. We don't have, by any means, enough money to make any kind of change in this. We're spending 2% of the entire gross domestic product of the United States just on this one disease, diabetes. And thinking that the medical system is going to fix this is wrong. We have got to change the physical environment we're in, and we've got to change the nutritional environment we're in, or we're not going to turn this around. One of the big struggles in my life has been linking together the powerful bureaucracy of the medical care system. We spend $2.1 trillion in the medical world. The powerful elements within the environmental world. And each of them is very self-contained. And I would argue they'd be a lot stronger if they were a lot closer together. EPA has a goal of every river and lake in the United States being swimmable and fishable. Well, I would like to see every river and lake in the United States being walkable. That is, to have a streamside pathway that people could walk or bike on. Because when you put these in place, you don't have to tell people to go out and exercise. You see them out there, and most of the time, they're smiling. And most of the time, the kids are active. We don't have to sit there as the doctor and wave our finger at people if we entice and create places that welcome us, that entice us to be active and to be happy and be connected with each other and with nature. We have got to stop the isolation of these two worlds of health and environment and really see each of them as building the other.